Welcome to this video. It's actually Saturday the 30th of May. And that means we're about 5 months into this pandemic now. And it really is quite amazing what basic things we still don't know about this virus. Now, I've been looking at the amount of people that are asymptomatic, who are infected but don't develop symptoms when they're exposed to or when they're infected with the COVID-19 virus. And after 5 months, I can fairly definitively tell you this morning that the number of people that get infections who don't develop symptoms, that are asymptomatic, is between 5 and 80% of those that are infected. I mean, really, what does this tell us? Not a lot. So let's look at some of the evidence for this. If you want to skip this video, the bottom line is the number of people who get infected and don't develop symptoms is between 5 and 80%. And it's actually quite hard from the evidence to be more accurate than that. So let's look at this in detail. It is quite interesting. Now, between 5 and 80%. So what I did was I looked at the authoritative sources yesterday that I could find. And this is for the Oxford Centre for Evidence-Based Medicine. So these are pretty switched on people. So between 5 and 80% of people testing positive for SARS coronavirus 2 may be asymptomatic. So even the Centre for Evidence-Based Medicine is giving this figure between 5 and 80%. And even then they're saying may be asymptomatic. So frustrating. You just want to get something more definitive than this because it's got such important implications. Now, symptom-based screening will miss cases, perhaps a lot of them. So this is patently true. This is patently true. And this is one of the important implications. So that means if we just screen for people based on the symptoms, we're going to miss a lot of people that are actually infected. The question is, of course, how many? We're not sure how many. Some asymptomatic cases will become symptomatic over the next week. Now, so we know this. In other words, some people are pre-symptomatic and then later become symptomatic, whereas other people remain asymptomatic for the total duration of the time they have the infection. The Oxford Centre for Evidence-Based Medicine says children and young adults can be asymptomatic. Now, that was a bit disappointing. I thought they would go further and give some sort of figures on that, but they don't. So they just say children and young adults can be asymptomatic. Now, we assume that they're asymptomatic at a greater frequency than older people. We assume it's much more likely that children and young adults will be asymptomatic than older people will be asymptomatic, but we simply don't have that data. And then the Centre for Evidence-Based Medicine says there's not a single reliable study to determine the number of asymptomatic infections. You know, to be quite honest, this is just not good enough 5 months in. Not a single reliable study. We need some sort of coordinated research program here. It seems to be all ad hoc. I mean, yesterday we looked at how a lot of the research that is published isn't that brilliant. It's some questionable research out there. And then this is saying there's not a single reliable study for such an important point. Now, we will know in the future when we have population-based antibody testing. Then we can correlate the antibody formation, that is who has had the infection, with a history of symptoms or not. So we will know this at some point. But I'd kind of like to get a handle on it at a much earlier stage. And it just doesn't seem to have come out of the population-based antibody testing that we have had so far. And this is developing at a pace, so you would expect there to be something there, but I couldn't really find it. So let me share what I've found. Now, what I'll do, obviously, here is I'll post all of these notes, and I'll post all of the links as well, so you can check all this for yourself. Now, early work on this was from the Diamond Princess. Remember this cruise ship that was quarantined in Yokohama in Japan? Now, 3,711 people on that were tested. 634 turned out to be positive. So that's 18% were asymptomatic. So of the 634 people that tested positive, 18% of those were asymptomatic. So there's a first figure, 18%. That was the first figure we went on. Now, having said that, most, but not all of the people, a lot of the crew were quite young, but a lot of the passengers were older in the older demographic. So given that they're in the older demographic, that might be higher than we would expect for the general population. But we're not really sure from that evidence. But anyway, the number there was 18% of asymptomatics. So 100 people that got the infection, 18% developed no symptoms. Now, this was an interesting study, and we covered all these at the time. This is the village whose name I'm not going to pronounce, but it's 50 kilometres. It's a village in Italy, up in the north of Italy there, 50 kilometres west of Venice. And again, here's the reference from the British Medical Journal. Now, all 3,000 people in the village were tested, and 50 to 75% were asymptomatic. Now, I remember this at the time. It was carried out by very reputable academic institutions in Italy. And yet the Centre for Evidence-Based Medicine in Oxford says there's still not a single reliable study. So it looks like the Centre for Evidence-Based Medicine considered this an unreliable study for reasons I don't know, but it seems okay to me. But nevertheless, this is what we have. So 50 to 75% of the whole population were asymptomatic. And the professor who was in charge of this study concluded that asymptomatic infections represent a formidable source of infection, of contagion. In other words, these people that are asymptomatic can be going around spreading the virus. So to me, this seems like a good study, giving 50 to 75% of asymptomatics. Good because these people don't get sick. Bad because they can unknowingly spread the disease. And yet the Centre for Evidence-Based Medicine doesn't seem to accept it as a reliable study. So I don't know why not. But to me, that's the best study we have so far. So it's looking like more than half of people that are infected don't get symptoms. Now, another study. 328 adults in Shanghai. Smallish number, I know, but that's the reference for that. 328 adults diagnosed with COVID-19 in Shanghai. Among them, 13 patients were asymptomatic at the time of diagnosis and developed no subjective symptoms 2 weeks before admission. So these were people that were actually admitted to a unit, but that had no symptoms for 2 weeks before and were asymptomatic at the time. They just tested positive. And all 13 were close contacts of the confirmed case. So again, it's not really telling us that much, really. It's just telling us that 13 patients were asymptomatic. And that's only 4%. So whereas this study in Italy is indicating 50 to 75% are asymptomatic, this study in Shanghai was suggesting that 13 out of the 328, I think that's 4%, were close contacts of confirmed cases, but again, a very small amount of people that were a small amount were asymptomatic. Only 4% were asymptomatic. So that's why these people were tested, because there were close contacts of confirmed cases. But only 4% of people infected were asymptomatic. The other 96% had symptoms. So very frustrating, isn't it? So we've got 18%, we've got 50 to 75%, and we've got 4%. Now, another study, Japanese nationals evacuated from Wuhan. So these were the Japanese people that evacuated from Wuhan fairly early on. 565 citizens were evacuated. Now, I actually like this study because the Japanese authorities follow them up for 30 days after evacuation. So that's more than double the normal incubation period. So if they were going to develop symptoms, they would do in this 30-day period. In fact, most of them would develop symptoms within a 5 or 6 day period. And certainly the vast majority of them by a 13, 14-day period. So if they're going to develop symptoms, 30 days is a very generous time to wait. And the result there, and this seems like a good study to me again, was 30.8%. So basically 31% of people, of the Japanese citizens, evacuated from Wuhan, who were positive for the antigen, 31% of those didn't develop symptoms. In other words, about 69%, 70% did, whatever it is. So Let's say 30% didn't, 30% asymptomatic, 70% symptomatic, roughly. So again, that seems like a good number, and that's, to tell you the truth, that's not too far off what I would expect. And yet the Centre for Evidence-Based Medicine doesn't seem to accept it. So far, that's kind of the number I'd be running with at the moment, about 30%, but, you know, it's unclear. Now, another study, asymptomatic and pre-symptomatic SARS coronavirus 2 infection in residents in a long-term care facility in King County, Washington State. Now, we covered this in some detail at the time. So there was the outbreak in this care facility in Washington State. I think it was just down the coast from Seattle, from what I remember. That's the reference. And the Centre for Disease Control came along and tested 76 residents, fine. And they characterised them as asymptomatic or symptomatic at the time of testing and for the previous 14 days. So these were people that had had no symptoms or had symptoms in the previous 14 days. Now, 40% of the residents were negative. 40 of the 76 were negative, fair enough. 23 residents were antigen positive and symptomatic. This is at the time of testing. So 23% were symptomatic, 13% were asymptomatic. And that means that of those positive, 56% were asymptomatic. So on the day of testing, 56% of positive cases were asymptomatic. But 10 of these 13 that were asymptomatic developed symptoms within 7 days. So most of these went on to develop symptoms. And what that means is actually 3 out of the 36 positives remained asymptomatic. So that's 8% were genuinely asymptomatic. Only 3 out of the 36 remained asymptomatic. So of these 13 that were asymptomatic, most of them went on to develop symptoms. So the true number that remained asymptomatic was not 56%, it was 8%. So 56% were asymptomatic on the day, 8% remained asymptomatic. But this is also interesting. The polymerase chain reaction values indicated large quantities of viral RNA in asymptomatic and pre-symptomatic people. So those that were asymptomatic had lots of the virus. Those that were pre-symptomatic had large volumes of the virus, similar to those that were symptomatic. So this is fairly convincing evidence, even though it's from a small sample, that people that are pre-symptomatic and asymptomatic can be shedding large amounts of virus, therefore presumably be very contagious, able to infect others. And this study rightly concluded that symptom-based screening on a particular day could fail to detect half of positive cases. They need to be followed up for a period of time to distinguish the pre-symptomatics from the asymptomatics. But again, this is in an elderly care facility, a long-term condition. So again, it may be that because it's an older demographic, there's a smaller number of people that remain asymptomatic. And there's more comorbidities here as well, whereas in the more healthy elderly population on the Diamond Princess, it was 18%. So basically, true asymptomatics, they're 8%. So we're getting quite a few different figures already, aren't we? Now, Iceland. Iceland, again, seemed to be a good study to me. It wasn't really a study. Iceland was just doing this work and they just collected the information as they did it. So, but it seems quite reasonable. The Icelandic authorities are very competent. And again, you can look at the New English Journal of Medicine reference. Now, their population screening, they did 643 people were found to be positive. Many more were found to be negative, but 643 were found to be positive. Of the positives, 57% were symptomatic and 43% were asymptomatic. So that's 43% were asymptomatic. Now, frustratingly, the study doesn't follow up and say how many of these became symptomatic. So unfortunately, that information is not there. But it does mean at any one time, then symptoms and not necessarily an accurate indication of infection. So you would expect the Centre for Disease Control to come up with something definitive on this, wouldn't you? This is the US Centre for Disease Control. And having read their guidelines in some detail yesterday, interim clinical guidelines for management of patients with confirmed coronavirus disease, and look at the reference for yourself. Now, they said 13% of children are probably asymptomatic. Well, okay, nice of them to give us that information. Less than I would have thought, but that's what they're saying. So they're saying 13% of children that get infected don't develop symptoms. I would have expected it to be higher, but this is the United States Centre for Disease Control. So that's the figure they give. Risk of transmission is thought to be greatest when patients are symptomatic. Now, this is not what the Washington State study showed. This showed that people that were asymptomatic or pre-symptomatic were shedding large quantities of viral RNA. But the Centre for Disease Control here is saying that people are most infectious at the time. Now, what they're basically saying is here is this is the time span here. So if this is suppose that's day one of infection there. Sorry, day one of clinical features there. And what they're saying is that people are most infectious in the 2 to 3 days. So say that's 3 days before they develop infections there. And that's 7 days after they've had infections there. What they're saying is people are most infectious. They get more infectious there. They're most infectious on the first few days. And then that gradually goes down to virtually nothing in about 7 days, providing symptoms have gone. If symptoms persist, that can be longer. So that's what the sort of the basic thinking behind the Centre for Disease Control. But the study in Washington State shows that these people are very contagious, and the people that are completely asymptomatic are very contagious as well. So that data is not really that consistent at the moment. So viral shedding is greatest at the time of symptom onset, according to the Centre for Disease Control, which would mean that people are most infectious during this first few days. And that may well be true, because that's what we get with other viral respiratory infections. But it would be nice to be more definitive. Declines over the course of several days to weeks after the first symptoms. And again, we know that most people are going to get better after about 7 or 8 days, but to be fair, we need to keep them for a bit longer to make sure they're not spreading the virus. But of course, we know that some of these people that are testing positive much later on might actually be testing positive for dead virus. So from that, what do we conclude? Well, people are most infectious in the first few days after symptoms, but are highly likely to be quite infectious before. People that are asymptomatic could well be equally infectious, and some people can remain infectious for well beyond the 7 days. Now, what has the World Health Organization got to say about this? Well, check their latest stuff yesterday, and it hasn't really changed. 80% of infections will be mild, will show mild symptoms or no symptoms. So the asymptomatic group are included in this. So this is 100% of people that get the infection, get the virus. So many will have virtually no symptoms at all. Well, some will have no symptoms at all. Many will have mild symptoms. So that's what the World Health Organization is still saying. 15% severe symptoms, 5% for critically ill. So again, it's not differentiating between those with mild symptoms and those that are asymptomatic. So it would be nice if the World Health Organization issued something definitive on this, preferably that agreed with the Centre for Disease Control and the Centre for Oxford-based medicine in the UK. Now, this is a bit different, but I put it in because it's kind of interesting. Asymptomatic coronavirus infection in the Middle East respiratory syndromes. This is not this pandemic, this is the Middle East respiratory syndrome. Now, this disease was first developed in 2012 and there was an outbreak and it started spreading, but fortunately the transmissibility was low. And it was indeed fortunate that the transmissibility was low because the morbidity, the case fatality rate, the mortality, the case fatality rate was very high. A lot of people that get this die. But because this started in 2012, and there's been a few studies on this over the years now, the extent of asymptomatic Middle East respiratory syndrome coronavirus infection is about 10%. So over the years, that's clarified to be around about 10%. So even a low 40-50% of people can die, 10% remain asymptomatic. Very strange with these coronaviruses. So what we can say definitively is between 4 and 80%, or from these studies 4 and 75% of people that get the infection will be asymptomatic. Not very impressive, but I think we've seen how important it is to know this. It looks like the best data is sort of the 30 to 50% range. So I suspect in a couple of years' time, people will be saying, well, when we look back, the proportion of asymptomatic cases in the COVID-19 SARS coronavirus 2 pandemic, the number of asymptomatic cases was about 40%. That would be a guess based on the limited data that we have, but very frustrating that we can't be more definitive than that at the moment. And let's hope we get some much better published research of good quality on this soon.